everyone, welcome back to my channel. This is the second video in my two-part series on axillary web syndrome, or cording, which can happen after breast cancer and melanoma cancer treatment. In this video, I guide you through 8 exercises to get rid of that cording, with 4 gentle stretches to use early on, and then 4 more advanced stretches to use later on to really get back to that full range of motion and function. I'm Alex Hill, your physical therapist for everything oncology and lymphedema. I'm a board-certified oncology physical therapist. I'm also a certified lymphedema therapist. Make sure that you subscribe and turn on those notifications for my channel so you don't miss any new videos on oncology and lymphedema. If you didn't watch my first video about what cording is and how to screen for it, make sure that you watch that first so that you have a good understanding about what this condition actually is. Before you start any new exercises, make sure that you check with your medical provider first. You may have some discomfort with doing some of these exercises I show you, but you should not have any pain. The first 4 exercises that we're going to do is for early on when you start to develop that cording, you have a lot more pain, you have much more limited range of motion. The second set of exercises are going to be for those who are getting closer to full range, you're not having as much pain. This first exercise is called elbow winging. This is going to help open up the chest and start to get into some of that cording. You're going to either lie down on a comfortable surface like your bed, or you can do it sitting up with a supportive chair behind you. You're going to start with your hands up kind of by your ears behind your neck, with your elbows close together. You're going to gently and slowly start to open them wide until you feel a stretch in the pec area or again into some of that cording. Once you get to the point where you feel a stretch, you're going to hold that for 5 seconds and then slowly bring your arms forward. You're going to open both arms out to the side and then let them come forward. Again, you shouldn't have any pain with this, but you will feel some stretching as that gets that cord into some tension. You can do this exercise in sets of 10, and you can do it a couple times throughout the day. The first exercise that we're going to do at the counter or the tabletop are going to be arm slides forward. So you're going to start with your hands flat on the surface, and then you're going to slowly start to slide your forearms forward to the point where you feel a stretch. Once you feel the stretch into that arm, you're going to stay there for 5 seconds, and then you're going to slowly come back up. As that range starts to feel better, you don't have as much pulling or pain, you want to slowly increase the range and get to the point where you can lie your arms completely flat. Again, hold that for 5 seconds and then come back up. As you bring your arms forward, you want to make sure you're not hiking your arm up or doing it in different positions to try to compensate for that pull. Again, you want to keep your hands flat, forearms slide forward, and then slowly come forward to the point where you feel the stretch. So this next exercise we're going to do at the counter or the tabletop, you're actually going to turn so you're facing perpendicular to the surface, and we're going to work on that abduction, or that movement going out to the side. So you're going to still have your hand flat on the surface, forearm also against the surface, and then you're going to go to the side until you feel a stretch in that arm where that cord is. Just like with the other exercise, hold that for about 5 seconds and then come back up. You'll keep repeating that in sets of 10, and you want to keep going a little bit further each time that you go down and feel that stretch in the cord. So you keep going down all the way until you can get to the point where your arm is flat on the table, and then come back up. Just like with the other stretch, you don't want to try to compensate or do things to try and get your arm all the way down. You want to just do it to the point where you feel the stretch. Coming all the way down, nice and easy. coming back up, getting a nice good stretch, slowly working on that range of motion. For the last exercise in this first set of gentle exercises, we're going to be doing some nerve glides. So with your affected arm, you're going to start it with your palm face down on your shoulder, and then you're going to bring your elbow back a little bit. Next, what you're going to do is extend the elbow out to the side, but you can still keep your hand flexed. And then you're going to bring it back up. So this is going to gently stretch the cord as you extend out. You should feel that stretch through the cord and then come back up. Again, make sure that elbow is back and you're not bringing it forward. That's going to give a little bit more tension. So again, palm facing the floor, elbow back, shoulders down. You're going to extend the elbow back away from you and then come back up. You can hold this for a couple seconds at a time and then again, gently come back up. You can do this in sets of 10, just like with the other exercises, and you can do it a couple times a day. And then once that starts to feel easy, you're not feeling as much of a stretch or a pull with that cord, you can then advance it to be more challenging and even more tension in that area. You're still going to set up in the same way, so palm on your shoulder, elbow back, shoulders down, but now you're going to include a head tilt away, and you're going to also open up your hand down towards the ground. So you're going to tilt away, elbow extends, and now you can see my fingers are pointing down towards the ground. You should feel a really big stretch through that arm. Bring everything back up and in, and then tilt head away as you extend the elbow, and also flex that hand, really bring it down to the ground, and come back up. You may still need to start with that initial stretch first, with not tilting the head and not flexing the hand, but work your way up towards this more aggressive stretch and nerve glide that gets into where that cord is. All right, now it's time for the next set of exercises. These are going to be more advanced. It's going to be getting a much deeper stretch into the pec and into that cording area. So make sure that you feel comfortable with those first set of exercises first before you move on to this next set of exercises. For the first exercise, you're going to be lying on your side with your affected arm on top. You're going to have your arms extended with your elbows straight. You're going to reach forward with that top hand, and keeping that arm reached, you're going to slowly start to rotate backwards. You may be only able to start in a small range initially, and that's okay. As you do this, you're just going to get more and more mobility. So again, you're going to reach forward and then start to rotate back, keeping that arm extended. I also like to do this with a breath. So breathe in first, reach, and then breathe out as you open that arm backwards. As you do this exercise, you should feel a stretch coming into the arm and into the chest area. You can do this in sets of 10 and do that 2 or 3 times a day. The next exercise, you're still going to stay on your side with your affected arm on top. This time we're going to make large circles with our shoulders, or something called a windmill. So again, you're going to have your arms extended out. You're going to take your top hand, reach forward, and then you're going to start to bring it up overhead and then rotating all the way around, so you're creating a large circle, coming back by your hip and then back to the starting position. A lot of people will get caught right here in this position because that's where the cord is at its tightest. And so that's okay if that's tight initially. Again, as you continue to do more repetitions, that will start to loosen up. So again, on your side, elbows straight, bring your top hand, reach forward, and then start to bring that arm up overhead. Bring it right by your face, right by your ear. Start to rotate backwards and get that full circle coming all the way around, back to the beginning. Again, I like to also do this with breathing, so breathe in first, and then breathe out as you extend, rotate back. Come all the way around, back to the hip, and all the way back up to the front. You can do this just like with the other one, sets of 10, and doing them 2 to 3 times a day. This next exercise is called an angel. I'm from the Midwest, so I like to call them snow angels. So you're going to start out on your back with your palms facing up. And then you're going to slowly start to bring your arms out to the sides and then all the way up overhead until they touch. And then you're going to slowly bring them all the way back down. With this exercise, you're going to feel that stretch across the pec and into the arm. The goal with this is as you start to bring your arms up, you want to keep your elbows and your arms flat against the bed or whatever surface you're on, and make sure that you do it in a slow motion with your elbows straight. Make sure you're not holding your breath with this. And again, if you start to bring your arms up because of that tightness, that's okay. Just work on starting to bring them flat against the bed. Come all the way up and then bring them all the way back down again. Again, just imagine you're in some nice cold snow and you're making some snow angels. All the way up, exhale all the way down. Just like with those other exercises, you can do those in sets of 10 and do them 2 or 3 times a day to start to get more mobile. All right, this last exercise, you either need to grab a door frame or a corner of a wall or a sturdy bookshelf. You're going to reach your arm up, and then as you hold onto that surface, you're going to slowly start to rotate your body away from your arm. As you do that, you'll feel a stretch in that arm coming all the way down into the pec and maybe even a little bit into the trunk here. You'll hold that for 5 to 10 seconds and then you'll start to rotate back. As you rotate back, that tension will come off. So again, you're starting out reaching up nice and high, start to turn away. So feel that stretch in that area of the cord. Hold that for 5 to 10 seconds, make sure you're breathing with it, and then rotate back. You can do this and hold this stretch for longer than 5 to 10 seconds, but this is a good stretch to get into, so a little bit more aggressive, so I definitely recommend starting out just doing it for 5 to 10 seconds at a time. Again, just like with the other exercises, you can do this in sets of 10 and do it a couple times a day, or really any time that you feel like that cord is starting to get tight, just go ahead and hop into any of these stretches. I hope you found this video helpful in treating the cording that's in your arm and maybe even into your trunk. Please like this video and subscribe to my channel so you don't miss any new notifications on videos to help you in your cancer survivorship journey.